Welcome to the UB Medicine podcast, where we'll explore science shaping tomorrow's healthcare. I'm your host, Dr. Allison Brashear, the Dean of the Jacobs School of Medicine and Biomedical Sciences. Today's episode takes a look at how individuals and communities navigate emotional wellness during the holiday season. For many, this time of year brings joy, but for others, it can be heavy with grief, stress, and burnout. Joining me today are two experts who understand these challenges deeply. Dr. Beth Smith, Chair of Psychiatry at the Jacobs School, who leads efforts to support mental health across clinical and academic settings, and Dr. Susan Orange, Assistant Dean for Education and Resident Services. And Dr. Orange works closely with medical learners and clinicians to foster resilience and well-being. Welcome to you both. We'll start first about understanding the weight of the holidays. So for many people, as I said, this is really joyful, but others, it brings on anniversaries, for example, of people who have passed or other events. So Dr. Smith, can you help us understand why this season is so heavy in those things, such as stress and challenges?
Sure. So I think the holidays bring out both the best and the most challenging parts of our lives. As you said, they can be very joyous, but they can also bring about memories and traditions that spark grief, make us miss loved ones who are no longer with us. We also have to think about loved ones who are with us but might not be available emotionally or cognitively because they're seriously ill or depressed or perhaps have dementia, and that can be very, very tough. I also think that, if you're already suffering from depression or anxious, you're supposed to be joyous at the holidays, and this could be really conflictual. And with the holidays, I feel like we have this hope and expectation, especially with a new year, that things will be different. And it's often different from the realities of our lives, and that can be very heavy for people.
Yes, I think, you're right. There's that script, too, of the holidays are supposed to be this magical time like you see in the Hallmark movies. And what you mentioned doesn't necessarily bring out, there's all that other subtext of those things. So what kind of pressures do you think caregivers and students and healthcare workers face? I mean, many are working through the holidays. We had a horrible tragedy with the blizzard on Christmas Eve several years ago in Buffalo. Can you just give us some examples of the stressors and maybe some things we can do?
Absolutely. Well, I think when I think about our healthcare workers and our residents, they often feel the stress of the holidays amplified. For those that have to work, these are busy times in our hospitals. They're flu season, respiratory season. Staffing can be low because people are off for the holidays. Our primary supports and our colleagues, our fellow residents might be home and away, and we don't have them. And I think that together on top of the heaviness of caring for people who might be suffering, scared, dying at a time that's supposed to be very joyous can be extremely heavy. And for some of our mental health professionals, they might be already starting to experience some burnout. They may have their own personal histories of depression, anxiety, stress, and they are really vulnerable during the season. So I think some of the things they could do: reach out for help, get support, prioritize things that are meaningful to them, and take as good care of yourself as you take care of your patients, your family. If I could give that one piece of advice, that is one that I think is so important. We don't often care for ourselves in that same thoughtful, consistent way as we do for our patients, our children, our parents.
I think you're absolutely right. One of my dear friends one time told me you take put on what you want to do and then cut it by half and the holidays are one example of that. And on top of that, with all that you mentioned, then there's all the other things that you feel like you need to do for the holidays, shopping, whatever, all events.
Yes, it's often very hard, I think, for mental health professionals or professionals, our students, residents, to balance. I mean, integrating work and life is hard enough, but then with the holidays and perhaps missing an event, a celebration, a tradition can be really hard, and hard on the families.
Yeah, I think that's a great point, hard on the families as well. Dr. Orange, how does grief, and burnout show up differently for learners and versus the practicing clinicians? So we have residents and we have medical students. I just rode down the elevator with many of them who I think have an exam. How does it impact them versus the people who kind of out in their careers and maybe have grown some roots?
Mm-hmm. So I think that one of the important things to think about with burnout is what it is. So it's emotional exhaustion, it's depersonalization, it's these feelings of a lack of accomplishment. So that kind of shows up the same in everybody. But there really are different triggers depending on the group. So with residents, with learners, residents often, they have moved to a new place, so their support structures are changing. So this is a place where we definitely see a trigger for residents, an opening for burnout to happen. They've moved away from their family, they have moved away from their medical school colleagues. And they're starting to realize the pervasiveness of this challenging field of medicine and how it's going to impact them even when they're home or they're off. So this is a new change for them that they're starting to kind of wrestle with. They also are seeing these annual shifts in responsibilities. They feel very rapid. They feel very substantial. And they are realizing that they also, in addition to caring for patients and having those responsibilities, they are also teaching and they have leadership roles. So taking all of that on as they're basically getting a new job every year as they move through residency, that's a difference between learners and practicing physicians. And really, finally, the final pressure for residents is this developing autonomy that they're feeling. The goal of residency is to practice independently, right? So they know that this is what they're striving for, and it can be hard for them to ask for help or ask questions when they're feeling this very intense pressure to prove themselves to themselves and to the people around them that they have what it takes and that they are capable of doing.
I think one of the things you described is this path of becoming a physician. You graduate from and get a bachelor's, and then go to medical school. That's 4 years. Or if you pivot into our 3-year track that we've talked about on a different episode, you graduate in 4 years, and then you become an intern and a resident. And that could be anywhere from 3, 4, up to 7 years. And then each year there's gradual increasing responsibility, all under the supervision of an attending. But by the time you exit and get your resident certificate, you are to be practiced independently. And so all of those times have different pressures. And then, of course, you've got the newly minted physician, newly minted leader, whatever, that all have different pressures. And then you layer on the holidays and the stress that Dr. Smith said really compounds it. I think one of the important pieces is to really stress that we here at the Jacobs School and across the health sciences are a community, and we want to support our internal community, but we also want to make sure that we're supporting our external community. And that means, I think, that we're going to be open. Dr. Smith, you've done a huge amount of making sure that our community has access to mental health during stressful times, whether that's during terrible times of impact in our community or during the holidays. But could you just say a little bit about how we at UB and through your departments and others support our community during these times?
Absolutely. So we support our community in many ways. First, through the Jacobs School, our department supports medical student wellness. And so we started that student level, supporting them with a program to provide therapy and psychiatric services for them. In our departments, we have UBMD has a wellness committee. We work with our hospital partners who help to take care of our physicians. And our department tries to increase access for our community, access that's acceptable and easy to come to us. And that's something that we've been working very, very hard on. This past year, we had over 50,000 outpatient visits across many different practices in our community. And we hope to just keep increasing that. So when people need us, we are there right away. And if anybody is in crisis, we also have a psychiatric emergency room, a help center that we staff. So we have crisis services, we have intermediate services, and outpatient services for all ages, from birth to, to those that are older in our community.
Yeah, your department has been incredibly active in all of those spaces, and we're very much appreciative. And I know that many people who have sought services have just likewise found so supportive. So thank you so much for your leadership in that. And thank you to all of your volunteer faculty who help do so much teaching. I've met several of them recently, and your volunteer faculty in the Department of Psychiatry are incredible.
Well, thank you. Yeah, we have 100 volunteer faculty members in the Department of Psychiatry that donate 10 hours at a minimum every year, and we have about 25% that donate over 100 hours to teaching, supervision, and work within our community.
That's amazing. And we're so appreciative for those in your department, as well as the volunteer faculty across the Jacobs School. We couldn't do what we do without the volunteer faculty, and I just want to say thank you to them. I just want to pivot a little bit and talk about building resilience and support. There's a book called, I think, Psychological Safety by Dr. Amy Edmondson, and it talks about how you create a space where people feel safe and supported. Dr. Smith, how do we create that? And Dr. Orange, chime in as well. How do we create that environment where people feel safe and supported?
Yeah, I think creating an environment of psychological safety is paramount. We need people to be able to ask for help without feeling humiliated, without being worried about retribution. We need them to bring us ideas. We need them to bring up their concerns, to be able to talk about a near miss. And I believe that is the foundation of taking care of and the well-being of our students, residents, and faculty, and having leaders that model that model how to care for yourself, that model work-life integration and well-being is also foundational.
Thank you. Dr. Orange?
Yes. So in addition to the psychological safety piece, from a learning perspective, we also talk about promoting a growth mindset. So this is the idea that you see your setbacks and your challenges as learning opportunities. And some of the ways that we encourage faculty and residents and medical education leaders to do this is by providing constructive feedback and normalizing the struggles that come in a challenging field like medicine. So we encourage residents to play to their strengths and train their weaknesses. We also talk about supportive ways in addition to increasing the supportive structures that we have. We also talk about decreasing or reducing the demands that people have, especially their work demands. So we know that both of these pieces, increasing the support and reducing the demands, is what we need to decrease the burnout and increase people's well-being, especially while they're at work. So we're launching a new effort in graduate medical education. We're having well-being mini grants. So residency programs will be able to increase supportive things like peer support or humanistic activities. But we're also encouraging them to find ways to decrease the demands, like cognitive load, for example. And if people don't know what that is, it's the mental energy that it requires to get your tasks done. So a great example of that is the Epic, the new Epic EMR. So that's going to go a long way to reducing people's cognitive load, because they'll only have to have one EMR that they're going to have to know about. And they will be able to direct their mental energy towards more rewarding and fulfilling areas of work. So we're hoping that residency programs can find similar things to that to build into their programs to help decrease the demands on the residents.
And thank you so much for mentioning the EPIC project. So for our listeners who aren't aware, that UB, Kaleida Health, and ECMC are all going hand in hand and launching into EPIC. EPIC is the electronic health record that is in 95% of academic health systems. And we will be going to that in 2026. Kaleida will go end of May, and UB and ECMC will go the end of October. And there have been many, many people working on this already and getting ready for this. It's a big opportunity because, as you mentioned, our physicians and learners will only have to log in one-to-one. And right now there are multiple different EMRs. So not only will it be better for all of the providers, all of the learners, it will be better for the patients. There are AI-driven tools that will be available to decrease cognitive burden. And I personally think we should be able to bend the cost curve, because your doctor will be able to see your labs from the different health systems, which right now it's very difficult. So you won't have as many tests and images, et cetera. So it's one of the most ambitious projects of this kind across the country. But Buffalo is the right place, right time, and has a great opportunity to do all of the things I've said. And so I'm hoping it will decrease burnout, although we all have to get trained, myself included. So I think, but it is very exciting. And I think that's one of the ways that we can think outside the box to decrease the stress and burnout. What are some other ways that we can build resilience at the institutional level, whether it's for learners or whether it's just resilience overall? Dr. Smith, do you have some thoughts?
Sure. I truly believe in people being educated in mental health first aid, in recognizing things like anxiety, depression, risk for suicide. We need that not only for our patients, but our peers, our colleagues, maybe recognizing it in ourselves. So I think that's paramount. Next, I think just integrating these initiatives into our practice plans, into our education, into our residency programs is huge. And I think lastly, we need to create a validating environment. So Dr. Orange, you mentioned, sometimes, that the experiences that residents have at the different stages. And we need to validate how difficult it can be, how challenging it can be, that, although they are really bright and motivated individuals, that we all run into, those brick walls from time to time.
I think there's this opportunity to reach out to another individual, and not only you're helping that individual. I think there's some neuroscience to say that the individual that does the reaching out also benefits, whether that's a smile, a good morning, or more purposeful reach out to create that positive energy around. And I, through the work that both of you have done at the Jacobs School and across all of the Western New York, thank you for creating that positive energy, because that's one of the ways we're going to improve the health of Western New York.
Absolutely. Isolation is a big cause, and contributor to burnout, to stress, to depression, to anxiety. Teaching how to connect with our patients, learning how to connect with our community, learning how to connect within our professional communities can be just a profoundly important preventative intervention.
Well, we're about ready to wrap up, but I have one last question for each of you. What is one key takeaway that you want to leave our listeners with? And just a simple sentence, Dr. Smith?
Sure. So the World Health Organization has said there is no health without mental health. I take this to heart that if we want to transform the health of our community, we need to address their mental health. And this includes the mental health of our learners, of our healthcare providers, of our entire community.
Thank you so much. Dr. Orange?
Yes, there's so much support for well-being in Buffalo right now. I'm so lucky, we're so lucky to be able to work with creative and talented physicians who are so passionate about doing this work and making healthcare healthy in Buffalo. So thanks.
Well, thank you both for sharing your insights and reminding us that healing is as much about connection and compassion as it is about care. Well, that's it for this episode of the UB Medicine podcast. Please subscribe to us and join us the next time as we explore the frontiers of medicine. And we'd like to hear from you. What would you like us to talk about next time? Thanks again.